Liver flukes, specifically those from the genus Fasciola, such as Fasciola hepatica, were among the first parasites to be discovered and studied. Fasciola hepatica, commonly known as the common liver fluke or sheep liver fluke, was one of the earliest parasites to be visually identified. This discovery dates back to the 14th century. The first known description of the liver fluke was by Johannes de Becca in 1379, and later by Francesco Redi in the 17th century. Redi is often credited with the more detailed and scientifically significant description and documentation of the liver fluke's life cycle. These early observations and descriptions laid the groundwork for the field of parasitology and the study of liver flukes in particular. Liver fluke infections follow a complex life cycle that involves different stages and hosts. The cycle begins with the excretion of liver fluke eggs in the feces of an infected host, typically a grazing mammal like sheep or cattle. These eggs must reach freshwater to hatch into muricidia, which are the first larval stage. The muricidia are free-swimming and actively seek out a suitable aquatic snail to infect, making the snail the intermediate host in the cycle. Once inside the snail, the muricidia undergo a series of developmental changes. They transform into several forms, including sporocysts, retiae, and finally cercariae, another type of free-swimming larva. The cercariae eventually leave the snail and enter the surrounding water. Here, they seek out vegetation, such as grass, near the water's edge. Upon finding a suitable spot, they insist on the vegetation as metacercariae, which are the infective stage for the definitive host. The infection of the definitive host, which can be humans, sheep, or cattle, occurs when they consume vegetation contaminated with these metacercariae. For humans, this typically happens through the ingestion of raw watercress or other contaminated freshwater plants. After being consumed, the metacercariae exist in the small intestine, specifically in the duodenum. The young flukes then penetrate the intestinal wall and embark on a journey through the abdominal cavity to reach the liver. Once in the liver, they burrow into the bile ducts. Here, they grow into adult flukes, feeding on blood and liver tissue. As adults, they start the reproductive phase of their life cycle, laying eggs that are then excreted in the host's feces, thereby completing the cycle. This life cycle underscores the importance of avoiding the consumption of raw watercress and other freshwater plants from areas where liver flukes are endemic, as a preventative measure against infection. Liver fluke infections, caused by parasites such as Fasciola hepatica, manifest through various symptoms that evolve over the course of the infection. The symptomatic progression can be broadly divided into two phases: acute and chronic, each characterized by distinct signs and complications. In the acute phase, which occurs as the immature flukes migrate through the liver tissue, individuals commonly experience fever, a natural response of the body to the invading parasites. Accompanying the fever are abdominal pain, particularly in the upper right quadrant due to liver inflammation, and general gastrointestinal discomfort, including nausea and vomiting. There's often a noticeable enlargement of the liver, known as hepatomegaly, and a significant increase in eosinophils, a type of white blood cell that typically surges in response to parasitic infections. Patients also report general malaise and fatigue, reflecting the systemic impact of the infection. As the infection progresses into the chronic phase, with flukes settling in the bile ducts and maturing, the symptoms become more focused on biliary complications. This phase is marked by biliary colic, a pain caused by the obstruction of the bile ducts, and jaundice, which is the yellowing of the skin and eyes due to bile duct blockage. Inflammation of the bile ducts, cholangitis, and the gallbladder, cholecystitis, are also common. In more severe cases, the flukes can cause significant blockages in the bile ducts, leading to liver abscesses and potentially serious liver damage. Chronic infections may result in weight loss and anorexia, as the reduced bile flow affects digestion. It's notable that some liver fluke infections may be asymptomatic, particularly in the early stages or when the infestation is mild. Diagnosis typically involves a combination of blood tests, imaging techniques, and stool sample analysis to identify the eggs of the parasite. Treatment generally includes antiparasitic medications to eliminate the flukes. The progression and severity of symptoms are influenced by factors such as the number of flukes infecting the individual and their overall health status. Awareness and timely medical intervention are crucial in managing the symptoms and preventing long-term complications associated with liver fluke infections. Treating liver fluke infections primarily involves the use of antiparasitic medications, with triclabendazole being the drug of choice. This medication is highly effective against both adult and immature stages of liver flukes, like Fasciola hepatica, and is typically administered orally. The dosage and duration of the treatment depend on the infection's severity and the patient's health. Alongside specific antiparasitic treatment, supportive care plays a crucial role, especially in severe cases. This may include managing symptoms such as abdominal pain and jaundice, and addressing any other complications that arise from the infection. Monitoring and follow-up are essential components of the treatment process. After the initial course of medication, patients usually undergo blood tests and stool analyses to ensure the flukes have been successfully eradicated and to assess liver function. If the infection persists, follow-up treatments may be necessary. Prevention of reinfection is also a key aspect of managing liver fluke infections, particularly in endemic areas. This includes avoiding raw or undercooked freshwater plants, such as watercress, and ensuring that livestock, a common source of human infections, are also protected from the parasites. In cases where triclabendazole is not available or effective, due to drug resistance or other factors, alternative medications like nitazoxanide or bithienol might be used, though they are generally less effective. Additionally, for those with significant liver damage from the infection, further medical interventions may be required to manage complications like liver abscesses or bile duct obstructions. The treatment of liver fluke infections is a comprehensive process that requires the guidance of a healthcare professional. It not only involves the eradication of the parasite but also addresses the broader health implications of the infection, ensuring a holistic approach to recovery and prevention of future infections.